Cervical cancer na one common disease wey dey up among women. Informate bin tell us say about 500 new cases na him dey and about 250,000 women dey die of am every year. Una welcome to our ogbonge program Time na Money on Top African Independent Television. I be your correct babe, Toyin Babawale. Una welcome. Now your health be your wealth. If you know dey healthy, how you fit get power to work to take get money? Now him be say make you no take your health gamble. Now this one make us one touchlight wetin we call cervical cancer prevention and treatment among women. Cervical cancer dey happen among women wey be over 30 years of age, wey don marry or get sex partner. Informate been tell us say cervical cancer dey caused by wetin oyinbo people call human papilloma virus, wey be HPV, wey dey transmitted through sex and dey cause infection for the cervix, wey be the neck of the womb in women. They come say this HPV fit change the cells wey dey for the cervix of the womb, and the changes fit come and then result to wetin we know as cancer cells. If detected on time, person go fit treat am. But if you no detect am on time, you no go fit treat am again. But you know say if you go for screening, and maybe if you dey positive and you no treat am on time, e go lead to cervical cancer. But if you treat am on time, you dey safe. If you get comments or you want more informate, make you like our Facebook page, wey be Time na Money on AIT. You go get more informate about the topic when you like our page on top Facebook. Also, if you want make we help you showcase your businesses, your goods and your services to the world, make your business for the go serere werere. Alele green horse on top the number where you dey see for your screen so. E be like say some women never too know wetin we dey call this thing, cervical cancer. Now this one make me enter streets to go do my usual torchlighting on top streets waka to ask we women wetin dem sabi about cervical cancer. Make you hear wetin dem talk.
Use your time well, do better thing. Money no dey fall from heaven, do better thing, money go come. Na true word I dey tell you so, una know.
The advice I have for government is for them to create more awareness for people, most especially the women, so that they will get to know more about that and how to prevent themselves against the disease.
Use your time well, do better thing. Money no dey fall from heaven, do better thing, money go come. Na true word I dey tell you so, una know.
E get as e be o. Some women say they don sabi am. Others say they no too sabi wetin e be. Na im be say a lot still have to be done. As e be so, I carry my waka enter where Society for Family Health, wey be SHF, and some other good people wey come join body together to have wetin dem call project dissemination meeting, where dem be share project achievements and then lessons wey dem been learn and the successes wey dem don achieve in the process of telling we women about this thing wey we dey call cervical cancer, treatment, screening and prevention. Oya, make we go see wetin dey happen for there.
Whichever community we entered, the response rate is very, very encouraging. However, we have some challenges at the onset. For instance, availability of cryogas at the onset. We use medical grade carbon dioxide for the cryotherapy machine, and there are only just one company, one or two companies that we are aware of that have this gas available for use. And sometimes when you go to them, they will not have the gas in stock. And so at the onset, that affected the treatment services that we could provide. But we were able to work through that by entering a very solid partnership with BOC Gas, for instance, to ensure continuous supply of medical grade carbon dioxide for our cryotherapy machine. And I'm happy to report that towards the end of the project, that challenge was eliminated. We have talked about the quality glacial acetic acid that affected our positivity rate, but we were able to overcome that by getting 5% pre-diluted vinegar. There are a lot of myths and misconceptions on cervical cancer, such that most women, when you want to encourage them to pick up tests, they will tell you several things about it. And that affected and hindered service uptake initially. But through the training of our IPC agents and the concerted mobilization that was done, we were able to overcome that. Denial was also a key thing. In Nigeria, we are a faith people, and most people will tell you, oh, it is not my portion, even when the diagnosis have been made. And that also affected the number of people. Several people will tell you it is not my portion to have cancer. In fact, when you just mention the word cancer, they say it is not my portion. I don't want to hear about it. But I'm glad that this project was able to break that barrier and people begin to own up and accept whatever thing that came from the services. Male support, as I said, was a challenge. Once a woman receives cryotherapy service, she is expected to abstain from sexual activity for 4 to 6 weeks to allow for healing. And most men find it very, very challenging to stay off, especially those in monogamous marriages. But we're able to hold many sessions and explain this clearly to them. It is better to have your wife alive and you wait for 6 weeks than to say, no, let me continue, and then she ends up dying from cervical cancer and you end up having nothing. And with some of these arguments, we're able to get the buy-in of the men to allow their women to go in for services. Funding was also a challenge, but we are happy that the project, even with the meager amount of funds that we have, we're able to achieve the results that we had for this project. Now that the project is ending, do we have any plan for sustainability? Is it that the project is, and everything about this is going to end? No. I'm happy to announce that we put in place plans to ensure that service delivery, both screening and treatment services, continue beyond the life of the project. And what are some of these? Number one, screening has been fully integrated into the reproductive services in these clinics. So the providers have been trained. Actually, we've trained well over 500 providers to provide screening services and treatment services. So anytime you go to any of these facilities listed in the brochure, even for any services, they will be able to provide service for you. In that case, screening services will continue beyond the life of the project. Again, trained IPC agents that have this message already will continue to create demand for the services. One of the things I'm happy to report with this project is the passion with which our providers take services. Some of them have gone out of their way to organize outreaches in communities, to churches, and even do it free of charge without the support of the project. And we've received commitment from them that services will continue to be provided. The person from NKC have told us how they have even gone ahead to institutionalize it in the training curriculum for the nursing and midwifery students in their school. So in this case, capacity is continuously built, and years beyond the end of this project, we are confident that service provision is going to continue. The project has also entrenched a culture of quality service in our franchises. So in this way, quality will not diminish even without the support from the project, because it is something that has been institutionalized. Providers have been trained and supported to source gas and cylinders for continuation. One of the things I would like to commend the donor for this project is the fact that they've agreed that the cryotherapy machine will remain in country. So that means that Thank you for that. So that means that treatment services is going to continue beyond the close of this project. So, and we've also linked up our providers where these machines are to be able to source for gas. We have cylinders for them. The cryotherapy machine is there. In fact, we've also linked them to technicians that can even repair these machines in the course that they break down, so that service will continue beyond the end of this project. Some organizations are also willing to support the state during outreaches. I've told you the support from the first ladies of several states in this project, and they are still willing to continue supporting. And so we are pretty sure that well beyond today, services for cervical cancer will also continue. Finally, what are some of our recommendations? We would like to recommend that screening for cervical cancer, being a life-saving intervention, should be made a priority by the government, the state, and several organizations so that these services can continue. We're only able to screen just about 400,000. You know, that is the drop in the ocean of the population of this country. So government needs to take up this challenge to sustain the screening and treatment services so that more women will be able to access services. The see and treat approach through outreach services is recommended for future implementation. Again, as I showed you, 80% of our treatment service as an organization, for instance, came from the outreach arm. And we want to encourage that for every organization that will want to take up these services beyond this project should consider the see and treat approach. But the hub and spoke model is still amenable if that is what resources can sustain. Integration of CCSPT services into routine reproductive health services should be institutionalized in all private facilities in this country, so that every woman that walks in to access services in any clinic, be it a PHC, a general hospital, or a private facility, should be able to have a speculum pass for that woman. Even if she is a postmenopausal woman, passing a speculum could be a life-saving intervention for that woman. And all our providers have been trained to do that. And we hope that the government should take it as a matter of policy that this should be institutionalized in our institution. Cryotherapy is cost-effective and should be sustained as well. The cost for a cryotherapy machine is ridiculously cheap, let me say so, compared to the gains.
Yes, as the beneficiary of this cervical cancer screening exercise, how I got about it was I just went to cover a work for a colleague. Fortunately for me, the exercise was on. They now asked me to come for the sensitization program. After that, I went for the screening and I found out that my result was positive. I became scared. I was like, cancer doesn't run in my generation. How come I had a precancerous cells? They now sensitized me more and encouraged me to go for cryotherapy. There is nothing I should fear about. That if the cryo is being done well and successful, that I will be enjoying my life. So they referred me to a divine hospital in Oka for the cryo. So I went there, the cryo was successful. The provider that treated me and now asked me to come back for checkup after 4 weeks. I came back and had a checkup screening. Honestly, my result was perfectly okay. And I'm so grateful to Maria Stope for sponsoring this project because they did it free of charge without collecting any dime. Initially, I thought it was painful, but the doctor told me that I should just relax my mind, that is a painless exercise. So they now use a nitrogen gas to freeze the cell. Then after freezing the cell, I will now leave it for about 4 weeks and come back for checkup. During that 4 weeks, the cells will be moving out with those freeze nitrogen. It will be coming out like a liquid as time goes on, but not immediately. Maybe after 2 days, it will now be flowing gradually depending on the body of the person.
In terms of reaching women with the need for screening as well as preventing cervical cancer in the future. So we worked in collaboration with the Planned Parenthood Federation of Nigeria, as well as the Society for Family Health, to implement this small but highly impactful project that help to prevent women that die ordinarily in our community from cervical cancer. The Nigerian government, as it is today, we do not have a national cancer screening program. And the awareness for cervical cancer is really rising every day. When we came up with this project about 5 years ago and commenced implementation, we had few turn up of women, but eventually as the demand creation increased and we started increasing women's knowledge about this project, we started receiving higher numbers. We started hearing about women reaching us in our franchisees. We started hearing about women that have severe need to screen. Everyone knows that prevention is better than cure. And everyone knows one other women in their community that have either died from cancer or cancer-related illnesses. So cancer is something that is in our community. But how do we prevent it? The knowledge is scarce. There are preventive measures to take. First of all, women need to be aware of their physiology and understand that they need to go for routine screening, because really there are risk factors for the development of cancer, but however, without screening, you wouldn't know if anything have started. Now, screening helps to increase the awareness of an existing lesion, whether be it cancerous or not, and then with the treatment, it is reduced significantly in the community. So there are preventive measures really for preventing cervical cancer in our community. First is for people to go for screening, to be detected, to have the early lesions detected and treated to prevent progression of the disease. The second one is when women that are negative take the human papilloma virus vaccine. We all know that 75% to 80% of cervical cancer cases are due to human papilloma virus, and there is a vaccine against the human papilloma virus. Those that are negative will benefit from having the disease even in future. So preventive cases, the use of the vaccine, as well as undergoing screening and treatment, and also early treatment for already diagnosed cases are the three levels of prevention that we will employ.
If you just join us, this na time na money on top Africa Independent Television, AIT, and we be the torchlight cervical cancer prevention, treatment, and screening in women. Them say it be dey necessary for every woman to go do the screening, and the screening be dey free. And if you can't do the screening finish, you can't dey tested positive, make you go the nearest government hospital where they near you. Now free, you go do the screening, and now free, they go treat you. Okay, my country people, now here we go draw the curtain on top of our ogbonge program Time Na Money. Make you remember, say your health now your health. Make you no take am gamble. And also, time na money. Make you make good use of your time. Make we do am again next time, my people. I be your correct babe, Toyin Babawale. Time na money. Use your time well. On a bye-bye for now.
Another man. Use your time well. Do better thing. Money no never from heaven. Do better thing. Money go come.